Hello, my name is Dr. Marcel Doré. Today in our video, we feature three dedicated individuals from three different walks of life, all who are fighting tirelessly every day to help fight COVID-19 in our long-term care homes and retirement homes. They represent hundreds of individuals and organizations who are also fighting daily to keep our most vulnerable healthy and safe.
Remember very clearly going to a meeting with physicians and some healthcare leaders, and this was in March. And I remember saying to them, it was at the beginning of March, I was saying, you have 2 weeks. You have 2 weeks before we will have cases to get ready. They listened, and certainly locally, we have done, I think, remarkably well.
So Dr. Mercer held the meeting with all healthcare leaders. I believe it was Friday, March the 6th, if my memory serves me correct. At that time, it cemented exactly the thoughts and feelings that it was coming to our community. We immediately started to meet as an emergency control group in our organization. We have that in place for any such emergency, and we started to meet daily. So we stepped up our cleaning protocols, we stepped up our PPE supplies, we stepped up our ordering, we looked at all of our resources and really started to look at that big picture about what we could do as an organization to make sure COVID-19 did not get into our facility and protect our residents to the very best of our abilities.
There was a regional response system for Ontario Health West and like long-term care and retirement. So very early we realized, as there was such emphasis on creating space in the hospitals, we have a non-hospital sector table meeting every day. So we have, for example, our primary care lead from Guelph and area and our OHT transformation lead from Guelph and area, community mental health, the LIN, for example, a long-term care and retirement home. And the structure was such that these residents are more vulnerable. And so as clinicians and as health system partners, we knew that we would really have to think about that particular community.
There are two pandemics that are happening locally. We have the pandemic that's happening in our community, and we have the pandemic which is happening in our healthcare sectors, specifically long-term care homes and retirement homes. The community cases, we have a good control over them. As people are staying home, physically distancing, applying public health measures like washing their hands, and only going outside for necessary or urgent trips, we have controlled those number of cases, and they are declining. When we look at what is happening in our long-term care and our retirement homes, it is a very different story. We see that we have increasing numbers of cases. We have healthcare workers who work in those institutions who are also cases, and we do not have it under control yet locally. We are working collaboratively with our LINs, with the Ontario Health Team, and with our hospitals and public health to try and give these facilities, these homes, the support that they need to be successful. But it is really difficult. This is a virus that is very infectious. It spreads very easily, and the individuals in these settings are very vulnerable. We do have enhanced testing capacity, and we have been saying now for some time that for individuals in our community, if you have symptoms, go to an assessment center and you will be tested. However, the increased testing strategy is really targeted towards what I call the second pandemic, the pandemic that's happening in our healthcare facilities, specifically our long-term care homes and our retirement homes. So if you are an essential worker, and if you are specifically a healthcare worker and one that works in a long-term care retirement home, any symptom, even atypical symptoms or mild symptoms, we want you to be tested. In addition to that, the provincial government wants to know the status of all of our long-term care and retirement homes. It does actually provide really useful information. It tells us a little bit about the number of healthcare workers or the number of residents who may not have any symptoms but may be positive, so that we can isolate them and that we can protect others in these communities. So enhanced testing is important right now for these settings, and enhanced testing is going to be critically important as we begin to open up the province and open up our economy.
Watching what was happening in not only our other provinces, in particular BC, they were slightly ahead of us, and they had the long-term care home that had a very large outbreak very quickly. That cemented that this was serious and we needed to take action. We started to look at human resources. That's the biggest part of how are we going to do work differently when we weren't allowed to have visitors and family members in helping us? What are our opportunities? And I think with every challenge, there's always an opportunity. I think we felt a lot better that we could probably fulfill most of the needs. So I credit our team with looking at how we could tackle this piece by piece, section by section. I'm really looking at, okay, how could we step up cleaning? Who else could help with cleaning? How else could we do work that we normally typically don't do? So we started to build capacity early on, and I think we were very fortunate that our staff embraced that and really looked at, okay, yes, we're here to help in any way we can, and they really stepped up. And I was humbled and overwhelmed. And the information, talk about the information in daily meetings, it was evolving on a daily, hourly basis. So I think the flexibility and the fluidity of the situation really meant that we had to be very adaptable and nimble to what could and how this evolved and rolled out.
As we've had homes go in outbreak and run into problems, we also have used this regional response structure to come alongside homes, to work with them and their regulatory bodies like the Ministry of Long-Term Care or the RHRA to come alongside and do some problem solving. Unfortunately, there are a fair number across Waterloo, Wellington that have been affected. And so what normally happens is either the home or the regulatory body or the LIN or public health, it's usually one of those four, will reach out and we'll trigger something called an IMS. So an IMS is, an incident management sort of system response. And we'll come together often in a virtual meeting across Zoom, and we'll talk to the owner operator, who obviously is there, about different areas. So often those areas are IPAC, so infection protection and control concerns, PPE, human resources, and of course, testing. Had in some cases redeployment of staff, for example, from the community or from the hospital. We've had public health and hospital IPAC teams to go in and work along with the IPAC expert in the home to think about the space and what would happen if there was more positive cases, how we would support residents, how cohorting could look like. There are myriad responses that can come through that table. We do have a process to check in to homes that are at moderate risk, so not just the ones that are in crisis, and I think that's important. There is a structure, certainly in Guelph, an area that's actually very developed, that is led by the OHT and the hospital and the LIN, that checks in on those homes and works alongside them exactly to avert crisis. So there's a really layered approach that's going on to think about and keep being very dynamic and coming up with pandemic planning that suits each home. All of that's going to serve us in good stead in the future with a better structure, with a better system and better response.
As we move forward in this pandemic, not just for long-term care and retirement homes, but for the broader healthcare sector, we actually have to start thinking about a new normal. We have to think about how are we going to do things differently to keep not just our residents, our patients safe, how are we going to keep our staff safe? How are we going to work in this new normal state? Until we either have an effective treatment or a vaccine that prevents people from getting this COVID-19 virus is going to be circulating in our communities. And there's always the possibility that it could cause an outbreak again. There's a lot for us to think about, whether it's in a physician's office, whether it's in a hospital, long-term care, retirement home, a physio clinic, a massage center. These are all places where people provide in-person care to individuals, some of whom are very vulnerable, especially in our congregate settings, as we try to manage and navigate not just this pandemic, but maybe the one that will come 5 years or 10 years from now after we've recovered from this one.
I am hopeful that we can open up our facility again at some point in time to family and friends. I don't know what that will look like. We've talked about a variety of different scenarios, but I'm hopeful that will happen sooner rather than later. Because that's been incredibly difficult for our residents and our families to be separated. And although the window visits and the WhatsApp and FaceTime are wonderful, it's not quite the same as being able to hold someone's hand. As a sector, as long-term care and retirement, the individuals who work in this sector truly love what they do. They put their heart and their soul into the work every day. We work 24 hours a day, 7 days a week to care for the residents who call our homes home. This is their home. How we can continue to do this moving forward, I think, is a testament to the people who choose to work in this line of work, who choose to work within this sector. Our community will learn from this. Our community continues to grow. Our community will continue to improve based on the learnings we've had over the last 6-7 weeks and what we'll continue to learn moving forward. If we can continue to work together as a sector and we continue to work with the family and residents, then the residents will only continue to receive phenomenal care moving forward. I think one of the greatest interaction that I've had to date, and perhaps rather humbling as well, is actually learning how to feed a resident. I'm a business background, I'm an administrator, operational, that I'm not a clinical person. So learning how to feed a resident and actually truly going through that process has changed me. I think it makes a connection to why we do what we do. As far as families go, our families have been absolutely incredible. From early days of donations, of sending notes, encouragement letters, emails saying thank you for taking care, thank you for stepping in and being the family to our family and loved ones. So we were not only staff members, but we were their family when their family couldn't come in.
I really appreciate the opportunity actually to speak about something that's important to me. I have had a colleague recently who's lost a very beloved aunt in long-term care, actually due to COVID. And myself, it really brought up memories of my grandmother who was very, very ill and passed away a few years ago. And I was thinking about, the incredible personal piece that this has for families. And all I can say is that for a very long time, in many cases, at least several months and sometimes years, family members have been cared for in these homes by PSWs and by RPNs and by nurses and physicians and administrators. And they are the same people who are deeply caring for those residents now. And, it's a very troubling time, but that piece I think is always there, that we've always had these frontline heroes. I've come to find out more than ever in this role how much they are really part of a family, and to ensure that they're taken care of, and they live and they dine and they entertain and they pass away there. That we have such a great community in Guelph and area and across WW, which only makes hopefully residents and families feel a little bit better.